Healthcare is one of the most difficult things within insurance by and large, especially just because of how complex the industry is, how expensive the industry is, and how much it's really hurting employers. And so the good thing is that this is a program where, and I always say like CFOs are our best friends because they love the Healthcare Navigator because not only is it cost containment, but it's making sure we're providing we're steering your employees towards quality care sites. So it's the best of both worlds.
Welcome to Insurance Shoptalk. This is the podcast where the world of commercial insurance gets a little closer to home. I'm your host, Eric Stein, and in every episode, we're taking a deep dive into the insurance industry, from the latest news and trends to in-depth interviews with insurtech experts, carriers, and agency newsmakers. We're covering it all. So sit back, tune in, and let's start the conversation. All right, today we've got Kayla Shawn with us, the CEO of the Healthcare Navigator in Dallas, Texas. She just missed the storms. Congratulations for missing those today.
Thank you. Thank you.
We're recording this in January 2025. Basically, I'm excited to have Kayla on because this is a little different spin. We normally stay in the P&C world completely, but this obviously is going to dovetail into it because many of the P&C agents that listen will have, themselves will handle benefits for their clients, or they have a benefits department. And I know that a lot of agents are, wanting to wrap up all as many services possible with a client, with the benefits and the P&C together if possible, and then kind of protects their book of business by doing that. And also, the big concern from we talked about earlier, Kayla, was that agents are always worried about big increases for pricing, not only in the P&C, but if they do offer the benefits, those
Right.
spikes seem to be very large compared to, let's say, workers' comp. And it gets to be a nasty experience for the agent on the P&C when the benefits go up. So I
Right.
think what I like about your service is that you can help manage this risk. And so that's why we wanted to have you on to go through your ancillary service here that goes on top of the benefits. But I won't
Right.
steal any more thunder. Why don't you kind of tell us a little bit about your background and how you started the company and what and all that good stuff.
Yeah. So thank you for the warm introduction. I currently run the Healthcare Navigator. So that is essentially an employee healthcare steerage program. And so how I always explain it to people is that right now, if your company, let's just say you have, most companies they have a healthcare plan. And what everyone is realizing now is that just a healthcare plan is not enough for a business, simply because it does not contain costs. Most times, actually, it can hurt the business because there are so many different things in healthcare that it's hard to control with just a health plan, right? So, for example, you can have the best high deductible health plan, but your premiums are still gonna go up extremely high because you had seven people from marketing who had major surgeries that year that were upwards of 200K each, right? So it's things like that where, like, yes, you can have the best plan, but at the end of the day, if your claims go up, you are still going to pay more for your premiums. You are still going to pay more out of pocket, and et cetera. And especially for your employees as well, they're not covered in that sense because they still have high out of pocket costs. And then for the PNC consultants, that affects you guys as well, right? Because those premiums are going to influence what deals you can get your clients. And the whole purpose of, this industry is to help people, especially businesses, make sure that they contain their costs to a point that it's not only manageable but helpful. And if it's eating into your profit, that's a bad sign. And so with the Healthcare Navigator, we're a steerage program. So we steer your employees towards quality care sites that are also cost effective. So instead of Martha going to the hospital that's 5 minutes away just because it's convenient, but again, she doesn't know any better, versus now Martha with us, she can pick the hospital that has the best quality based off of clinical performance, which is key, right? You want to know your doctor's history, you want to know your hospital's history, you want to know the price, but you can't Google that kind of stuff. So with our app, you just go on there, you find the prices for the hospitals for that procedure, you find their past clinical scores, so how good they are essentially. And you get essentially you get the information that you need to make an informed decision. And so that is we do a myriad of other things that we'll get into this podcast, like labs and etc. But that is mainly what we do. So we are essentially a risk management strategy to make sure we're containing those risks so that Martha doesn't end up going to that overpriced doctor, overpriced hospital that has poor quality scores, right?
Right.
So that's a good nutshell.
Yeah, and like so the I mean, I've seen it myself just personally, just like going to a hospital, it's when you ask how much it is, they won't tell you. There's
Right.
no transparency there. And even in some physician offices, they can't even tell you just to say, hey, yeah, we're gonna bill it, we'll let you know.
Yeah.
So what's the data source to get this information that's in your app,
Right. Well, first off, physicians can't tell you that. And it's not because they're trying to keep anything from you. They just don't know, right? They don't go to medical school to learn the billing codes and things like that. They learn how to save your life. And so I always try to like preface that with people is that like your physician will not know the price most times. But the way that we're able to get all of this data, which is a lot, more than I like to admit. It's great, but it's a pain. But we get it from several sources. For the hospital prices, for example, we get it from every single hospital in the nation. So if you're thinking about the data mining part, that's a lot. That's a lot just on our side to even get that information. So the prices you see are literally from the hospital price transparency files. Same thing for your insurance, right? They have to post their prices. And then for the quality scores, we get it from those, either let's say like American Cancer Society, they have their own guidelines for performance scores. Same thing for CMS, same thing for Leapfrog. There's all of these, I like to call them, they're not necessarily governing bodies, but they're bodies of, either CMS is obviously the government. So they are like accredited sources where physicians have to report and hospitals, they have to report their quality.
Got it. All right. And also, maybe go into your background too. Like, how'd you get started in this?
So I came from the dark side, as they like to say. I actually started off first in hospice, believe it or not, which and I started at a very young age. So starting at a young age in hospice was extremely transformative. And I honestly say that's one of the reasons why I am where I am is because I saw so much. I mean, as you can probably imagine, at such a young age, right? It's people on their deathbed. So it's not always the funnest job, but it was one of the most rewarding and one of the most insightful. And then from there, I went to hospital administration. So I actually worked in the hospitals, I went through departments like the finance department, strategy, business development, operations. So I was, in there for quite a long time, and that helped me really in my journey here because now, right, I was born per se on the other side. I was born on um that side where everything is happening. And so I'm able to transfer that knowledge, me and my team were able to sorry, let me start over. Me and my team are able to transfer our knowledge from healthcare into our platform, into our steerage program, because we've been there, right? We were on the other side. We know exactly what to look for and what to do. And so that has been I'm so grateful for my past in that because we're able to provide such, effective solutions that you cannot get right now without us.
Makes sense. Um, and so with an agent, um, has a scenario where they do, want to, either introduce their benefits broker at their agency into an account, or they themselves are going to present. And of course, they're going to, shop the healthcare pricing like they would normally. So can you kind of walk through the sales approach of like how to present the benefits of what you do in a big
Right.
picture view that if as you train brokers, I know that you do that. So what
Yes.
advice would you give of how to sort of upsell this model of risk management?
Right. So the first thing to say, and it's always, brokers, they love this. Luckily, the Healthcare Navigator is an easy sell, right? Because as you can imagine, and as everyone knows, healthcare is one of the most difficult things within insurance by and large, especially just because of how complex the industry is, how expensive the industry is, and how much it's really hurting employers. And so the good thing is that this is a program where, and I always say like CFOs are our best friends because they love the Healthcare Navigator because not only is it cost containment, but it's making sure we're providing we're steering your employees towards quality care sites. So it's the best of both worlds. And so that's the first thing is that luckily it's an easy sell. When I always talk to brokers about how to approach it, because, with anything that is, we are, a steerage program isn't necessarily new, but the way we're doing it, where we have it both in an app and a live version, that is, the innovative side of things. And so whenever I, coach brokers on this, I always make sure to one, take them through a step by step where it's easiest to communicate what this is to an employer by giving them examples. So, for example, Tom from finance, right? We all know that he has diabetes on steroids and is, really, he's on several medications, etc. Instead of Tom getting his medication for his diabetes medication for, $400 with the Healthcare Navigator because of our Freedom Meds, we can get it to him for 185. Instead of Tom going to the hospital down the street, now he can choose a hospital based off of their prices and their quality scores. So he knows he's getting the best quality care for the most cost-effective price because unfortunately, patients think that higher quality care means higher price. And that's not true at all. There's been so many studies out there that have disproven that. And so that's another part. Then you have, Tom for diabetes, right, which is a common chronic disease here. You need a lot of labs. A lot of employers don't think about the labs part. And so with the Healthcare Navigator, instead of getting your labs that's marked up by 5x in the market, now you can get the same labs the Navigator labs for a 55% off market price. So there's another cost savings there. Instead of Tom, picking a doctor just based off of what his buddy said was a good doctor, he can actually go into the Navigator and find the quality, the performance of the every single doctor in the nation to pick which one he wants to do, to see their prices beforehand. And so it's all about providing them with informed decision making that steers them towards the right places of care. And so, those examples, when you tell that to employers, they instantly get it because they know right now their employees are going in blind, right? How many times has someone just gone to the hospital because either someone they knew went there and they came out alive, or they saw a pretty ad on the highway? That's all people have to go off of. You can't Google this kind of information, unfortunately. And so that is normally how I tell people to frame it. And once you do those examples, they get it, right? And so on average, we're able to save an employer about $4,600 per engaged employee. So, for like, we just did a savings analysis for an employer of an auto group, right? We were able to save, he was a 300 life group, and we were able to save him just with our medical steerage alone around, I think it was about $480,000 just on medical steerage alone. We're not even talking about the prescription savings. That was about 300K. So off the bat, we're able to save them so much money just based off of our steerage alone. Because if you know, and yeah, if you're on the app, you know, right? A knee procedure, right? Getting a knee surgery can vary. It can be from $4,000, $5,000 all the way up to about, I think the highest I saw in, at least in Texas, was around $45,000. So that difference alone is huge. And the quality on top of that, right? You want to make sure that you're going to somewhere that has a low infection rate or low, readmission rate, like all these things that count. You want to make sure you're going to those places. So examples are the best way to sell it to employers. And then at the end, I always add on the cost savings. So if you want to just make it succinct, right? On average, for a 300 life group, we're able to save them at the very least 500K. And then that's not even adding the prescription savings onto that. So that's normally how we're able to, help people upsell it. And it goes by pretty easily.
Would you say the target for this is it employers that have the partially self-funded plans then, or is it just someone that's with Blue Cross and they're not at risk other than their premiums, going up for renewals? But who's the target, would you say, the best target?
The best target I'd say is going to be your self-funded groups, your captive groups, reference-based pricing groups, those that specifically as well, and your level funded. We can do all employers because again, everyone has claims, so and everyone has high healthcare costs. But the ones who gravitate towards it most are going to be your self-funded, your captives, level funded, reference-based pricing groups.
Okay. And then, so talk about your staff behind it. You mentioned that you not only have the app, but then if their patient has a question, they can call. Are they speaking to a nurse or are they, how does that work?
Yeah, so we have it on both sides. So if you, let's say, have an older patient that doesn't want to use technology, you can call our navigators is what we call them, which is, it's in the name. Um, and so you can call our navigators and they will help that person with whatever they need. So if you want them to find you a hospital to do your surgery at, we can do that. If you want them to find a new doctor for you, we can give you some based off of all the information that we have, right? Because the most important thing is the information that we have and our healthcare knowledge, right? Our prior experience from being in the hospitals. That way we're able to quite literally give you I always call it the answers to the test, on the phone if you want that, or you can do it on the app.
And um, and then pricing wise, like give a range of, let's say, whatever you have in front of you there, like what it would cost the employer, to add this on to their
Yeah.
existing.
If you have a 1,500 employee range, then that's going to be about $6 PEPM per employee per month. And then we do provide commissions. So if you're our broker, then you're going to get for that one about $1.6 per employee per month. So you get that, monthly recurring revenue, which is great for them. They love that. So for that broker, for that one deal, that's going to be about 57, almost $58,000 just on that one group for the year in terms of commission. And then the savings for that group, on average, we're able to save a 1,000 employee range group, we're able to save them about in the range of $1.2 million on that one alone. And then we'll talk about prescriptions. Prescriptions for that is going to be about 300K as well, just on the low end. And then if you have a 5,000 group, that's going to be $5 per employee per month. And then PEPM for you, for the broker, is going to be $1.40. So that's about $126,000 for you as a broker. And then it goes all the way down to, let's say if you have a $50,000 group, your PEPM or your annual commission is going to be about $900,000. And then it keeps going from there. So the larger you provide, obviously, the more you get in terms of commission.
Makes sense, makes sense. And again, I think a lot of agents, that we work with are dealing with clients that are on the smaller side. So let's say 25 to 100 covered lives, what would that run? Just
So
on,
that's going to be,
right, let's
so
call
that's
it 100.
So for 100, that's going to be $8. So your PEPM is going to be $2. So that's about 7,200 for you as the broker for the year. And then if you tack on, if you have, let's say, 5, 8, 9 groups, then just multiply that 7,000 by the number of groups that you have.
Of course. Hey, everybody, it's Eric. I just want to pop in for a quick announcement. Exciting news. I just launched my new book on Amazon. It's called The Blueprint, an insurance agency's unconventional rise to the top. And it goes through a little bit about how I built the agency Insured Solutions since 2009 to today. And the blueprint in terms of how I actually did it with the tech stack, the offshore, nearshore talent, and digital marketing techniques that I use. So pick up a copy today on Amazon. Thanks, guys.
Great.
And as far as the trying to, you're obviously you've got the premium and the pricing that the client's paying for that. And again, if they're not partially self-funded, are you seeing pushback for clients who, let's say, have Blue Cross, Cigna, United, your basic, just, healthcare plan? I mean, how has this been helping them with renewals in terms of
For
not?
the regular, for like the fully insured.
Yeah, what's been going on there for those that are just fully insured?
Well, a lot of, I mean, as you can, I'm sure as you know, right? 2024 was just about the worst year when it comes to premium renewals. I think I remember one group that we talked to that was fully insured. They had about, I think, a 75% increase in their premiums. So they love us because of that, cost containment. They actually came to us after the whole renewal thing happened and they were like, we need to get on for 2026 because already with this renewal for 2025, it's so bad. So, if anything, because of the rise in premiums, it's actually helped in terms of our selling because it's just gotten so bad when it comes to premiums, and that comes from your claims rising, right? So the incentive for the employer is to lower your claims, but also to satisfy your employees so that they feel that like, okay, my employer actually cares about my health, right? They don't just, want to kick me to the curb. They actually care if I'm healthy or not. And so for them, it's just been a lifesaver when it comes to that.
Got it. And so then they can help hopefully offset renewals by this, $8, $9 per employee per month, which is not that much. They got possibly could even pass some of this on to the employee or no. It's not that
A Pepin?
yes, the per employee per month or
Um, we have not had that ask just because the ROI is extremely healthy. If you do the math, right?
yeah, for
It's
on the employer side. Okay.
Yeah, I mean
No, I get
it's
it. It's not
like
that much either. So it's
yeah,
the
if you're saving about like if you're even just like a small employee, right? Employer group, if we're saving you at the very least $150,000 and then our PEPM is $8 per employee, that's what 800 per month compared to 150,000 for the year alone. Not even talking about prescription savings, which is a lot more. So, we've never had a problem when it comes to the pricing because they see the savings, right?
makes sense. And the how about the prescriptions? You were talking about that, so they can, is it any drugstore they can go to get these and figure this out, or how does that work? Or mail order?
So yeah, so so we call it Freedom Meds is our prescription savings program. And essentially, we're talking to brokers here. So on the healthcare side, for pharma costs, that has been one of the number one drivers when it comes to healthcare claims, right beside procedure costs. So on the pharma side for prescriptions, right, we have a program where we have essentially collected, we've done the work for the brokers is really what I say, because we have put together all of the, pharmacy partners that you would need that are low cost, so that you can make sure that the prescriptions are, the same prescriptions, but just lower cost, right? At a way that is way more manageable than what we're seeing right now. And so we've brought together the people that you would normally, the broker normally tries to go after themselves in like research and stuff. We've put together a group for you. We've vetted them already, so that we know like these people have agreed to be low cost for our, for our clients that are in the Healthcare Navigator. So if
How do they,
anything,
and so how do they physically access the prescription? Is that phone, mail, a pharmacy?
so for some of our partners, they have like the pharmacy card, but normally what brokers and their employers will do is that they will take whatever medications like historically their employees are on, and they call that a formulary, and they will go to one of our partners that they choose, right? And let's say I'm like, partner A. I'm the employer, I go to partner A and I said, this is our formulary. What can you get us? What price can you get us at a low cost, for X amount of, for this year, the next 2 years? They will lock in a price with you that you like. And so get that filled at the pharmacy that's associated for the same price. So it's locked in so that you can either get it. Some partners do the mail-in, or you can just go to the pharmacy itself. So it just depends on what the employer wants.
Gotcha. So either mail order or go to a CVS or Walgreens, what have you. It's just all based on the what the preset
Yep.
pricing that you gave on that particular group, and it's
Yep.
customized for each group based on their medications.
Yep.
Got it. And then the employer, though, other than that, they don't get or how do you gather that information and comply with HIPAA and everything as a about the prescriptions as an
So
example.
that's between you. So the Freedom Meds is just essentially our network of people. We don't, the Healthcare Navigator, I mean, we are HIPAA approved in terms of like our website, but when it comes to like fulfilling the pharmacy orders, like that's on that, the partner does that, right? We just provide you with like we provide you with the people that you would have needed anyway, just in one place to, put into your employer group's plan for the year.
Got it. And then, but if you're fully insured, you don't really know the prescriptions your employees are on, right? So
You fully insured, you have access to your claims. I mean, if your if your insurance company isn't letting you see access, then that's like they call them like red flags nowadays, right? That's a red flag.
as
So
the employer can see it, I guess just not by and just not with the name of the insured then of the
they
employee.
can de-identify, yeah, so they can de-identify the claims. You don't have to, um,
Employee, okay.
yeah, so I mean like de-identified. Yeah, you should be able to access your de-identified claims. Um, but for your question, the I'm sorry, can you repeat your
Yeah,
question
yeah,
again?
the prescriptions like had if like if I have a 100 employee group on Blue Cross, I don't
Mhm.
really as an employer I don't know what their prescriptions are unless you said
Oh, gotcha.
I can pull a report from Blue Cross to say show me prescriptions that my employees are on without their names.
So, if you're, let's say Blue Cross Blue Shield and you want to use Freedom Meds, if you're fully insured, then you would just tack us as an additional onto your plan. And that's because, so for example, and I'm sure everyone's heard about the high cost with PBMs, right?
Right.
The costs are rising because of PBMs. So most times what employers have done nowadays is that even if you're fully insured, the smart employers will add on Freedom Meds to their plan because they will look at our Freedom Meds, like our list of medications, and find that, let's say, like drug X is 50% cheaper on Freedom Meds compared to what the employee would have to pay with Blue Cross Blue Shield. And so the employee is going to be like, I don't want to pay, 20%, 20x more with Blue Cross Blue Shield, especially if that's just going to go to my high deductible health plan, right? If I'm on a high deductible health plan, that means I have to incur more of the out-of-pocket costs. I want to get the same medication for cheaper. So you can do it as an add-on, so like a additional tack on to
Got it.
your
So you
plan.
go Blue Cross first, and then to compare, you could just go to Freedom Med. Okay. Oh, that makes sense. That makes total sense. Um,
And that helps with claims as well, right? That helps reduce it. Either way, it's going to help.
right, and it helps with reduce claims, but then in turn should help reduce that renewal
Yep.
increase. So you don't have to tell an employee who's got a family and they're already paying, let's say, 2,500 a month or 3,000 a month, even after the employer contribution, it's going up another 500-600 bucks. Hopefully, you can just keep that renewal in check. You know.
Right.
Okay.
Because it's all based off of your claims, right? And that's what everyone's right now, what we're battling. Because healthcare as an industry, it's becoming more complex to navigate. So the likelihood of your employee going to an overpriced hospital, not even overpriced, let's put aside overpriced, going to a hospital that is low quality, but like low cost, is just as pricey as going to an overpriced hospital because the amount of cost it is to when you get an infection at the hospital, on average, is about $20,000 tacked on to your medical bill. So if you get that infection, not only do you have your original bill, you also have the additional cost for them to take care of you for the infection you got at the hospital. And then same thing for your readmission rate. A readmission rate can add on anywhere from 30K to $65,000 just onto your original medical bill, right? So all of these quality scores that we have on the app and that we have access to, you can see that so you can, reduce the risk of your employees going to those low quality care sites, those hospitals, because now they don't have to worry as much about their likelihood of getting an infection at the hospital, getting readmitted because there was a surgical complication, whatever the case may be. And so that part is really the meat of it.
Makes sense. Okay. Got it. Are there any other, benefits you'd want to kind of get across as we kind of wind up here?
Yeah, I think an interesting, and I you and I were talking about this in the beginning when we were first just talking on the podcast, but one of the things that's been extremely interesting is just how much employers are getting more involved in healthcare, right? Before it was just kind of like, okay, we'll let, whoever, this one person deal with the whole benefits for the company. Now we're seeing CFOs getting into the meetings. I've actually had several CFOs come to us like directly instead of their benefits consultant because their healthcare costs are at like ridiculous and that they don't trust their benefits consultant. So for the PNC guys, right? That's an opportunity for you guys when it comes to not only keeping your book of business, but really leveraging the issues that we're seeing in healthcare specifically for employers because a lot of them are just getting sick and tired of not feeling like their benefits consultants are doing right by them. So what that means for you is that's a way for you to swoop in because we're already seeing an influx on my calendar right now. I'm booked to the nines with just CFOs and total rewards managers themselves, right? So if they're bypassing their benefits consultant, that's a way for you to show even more value, protect your book of business, and really, really show up as a hero in that sense. Because claims are going up, premiums are going up, and people just have realized the old ways aren't, it's just not sustainable anymore.
Not working. Yeah. So like in that now you're saying that again, with, I could use you as a PNC broker. I can use you kind of as like a lead in where before you were an afterthought. I want to talk about the PNC, package first with a CFO, but now you're saying that the CFO is more interested in the conversation today to meet just with you versus, let's say the benefits broker, then I can introduce you in. Now I'm
Right.
letting you just present about cost containment of benefits in terms of the benefits. And then I come in the secondary conversation is about the property and casualty. So that's a bit of a twist.
Yeah, it's a way for you to, it's not only a way for you to win more favor with your client, it's a way to show I'm not just looking out for you in this area. I'm even looking out for you in this area that I may not be in specifically, but I know for you, this is a really big issue for you. In sales, what we always say is that listen to their pain points. Don't just talk at them, like listen to what they actually need. If any of you ask your employer, your CFO, the CFO of one of your clients, how much, like for example, we had a 300 life one, their healthcare costs were, I'm not even joking, $3.8 million just on healthcare claims alone. And that is ridiculous. And so when you get up higher and higher and even lower and lower, it's a disproportionate amount than what it should be. And so when you ask your clients, is healthcare an issue for you? Or healthcare claims are an issue for you, they're gonna say yes. That is a surefire way to get a quick yes. And so when you're coming in as their PNC and saying, hey, there's a steerage program that could, really, really help you guys, and you can show our case studies, you can show our results, etc. That proves that you're not just in one place, you are well-rounded and you actually care about the full employer, not just one part of it. And that shows more genuine care and trust, especially with business where it can be sort of, a cutthroat area. They can see you more as a partner and an ally, not just someone who's trying to sell them something.
Right. And then on a somewhat of a smaller scale, just in my personal experience, our parent company kind of switched over to a partially self-funded plan, and they put in a service similar to what you have, but then yours is, I think, a little more intense and helpful with the technology part. But basically, they have a guided process. And if you call in, you have to call in,
Yep.
and get referred, let's say, to a doctor, or hopefully you use your own. If their score is good enough, you keep your own. If not, they'll recommend others.
Yeah.
And if you stay with your doctor, they don't recommend it, and you just pay a copay. But if you would go with the one with the better score, you get 100% coverage, no copays for that doctor, no out of pocket whatsoever or procedure. Uh,
Right.
and so I've seen this it takes a little extra time. You can't, of course, work on an emergency, but
Right.
it's a little bit of navigation on the employee's part and my part to think in advance to make that a call before I set that doctor's appointment if it's not urgent, right? And anyway, I can just see that because, family of four, we're all getting these guided coverages with a no out-of-pocket cost, uh,
Right.
and no lab fees and MRI fees. And if you follow the process, it's very unlike an HMO. It's a lot easier because you just got a phone call. So similar to your product, I think.
Yeah.
Actually, again, yours is easier because you got the app. This didn't have the app, but
Yeah.
my experience is like, and it was kind of a pain in the neck for me at first because I was just used to Blue Cross, and just
Right.
go and you don't think about it and just pay your copay and get out. But then you always get that balanced billing at the end where you
Yeah.
still after even you see the doctor, you're still paying maybe a couple of $100 if they do a lab or
Right.
something, right? At the
Yeah.
office. But anyway, so I can see the value of it now and how much out of pocket it saves when you've got four people running through, prescriptions and doctor's visits, even though we're
Right.
fairly healthy, So
Well, yeah, and I would add two things, right? If you are um for I never, anyone who's trying to help within healthcare, I am always going to love them. But I think for businesses, right, what you want is a navigation plat or system program that is easy to use, your employees actually like to use it, and it's quick and easy, right? We live in a very, very fast-paced world right now. You can Amazon basically everything and get it the next day. And so you want if you do decide to do like navigation, you want a navigation platform that's quick and easy to use. That's why we made it an app version where you can just get all the information in 2 clicks. That's it. If my grandma can't use it, we don't put anything out there, and she uses it every day. And so with the calling thing, right, we have the live call option where you can call somebody. But to the point about engagement, you want to make sure that your employees actually like it. It's easy to use and it's relevant. And that's where we come in, right? Because again, everyone is using apps nowadays and people just want to get in and out. They don't want to stay for a long time. And so just be careful when talking about like you'll see companies period talking about like, high tech, but really it's just like a fancy FaceTime where someone's going to tell you all of the like where to go, but you don't get the information for yourself. And that's the whole point, is so that you know without a shadow of a doubt what, where to go because of the evidence.
P&C agents, have you run into Byberg, which is a Berkshire Hathaway company quoting workers' comp for either your prospects or clients? Well, great news. Insured Solutions, a national MGA, has an appointment that is set up to allow you to quote, bind, and service Byberg at your agency. And the coverage is in all states. It's A-rated. Startups are even accepted. There's $125,000 maximum premium. And some of the tough industries they write are construction, transportation, that includes towing and parcel delivery, manufacturing, security guards that are armed and unarmed, motor mediation, and many more. So go to our website at insuredsolutions.net, click the Get Appointed link. We'll get you logins for you and your team, and can set up a webinar for training if you'd like. Also, feel free to email info@insuredsolutions.net, and I can handle the submission myself, or call 770-402-5343. Be glad to speak to you and give you more detail. Thanks. Right. Where you're, like, again, this system that I use, they have to, like, it takes a couple of days. They got to email you back.
Yeah.
You know what it is. I'm like, well, I have an appointment tomorrow. What can you do for
Yeah.
me? So to your point of the app is really cool. But so, Kayla, what's the best way if some agents have questions or they want to get more information? What's the best way to get in touch with you and get info also?
Yeah, so you can go to our website, www.thehealthcarenav.com, or you can message me on LinkedIn if you want to. So that's just Kayla Shawn at the Healthcare Navigator on LinkedIn. And we're happy to show you a demo. And then normally we provide a savings analysis for one of your companies or your clients, sorry, so that you can see line for line how much we're able to save each person on the plan, to give you a better estimate of how much, how effective we actually are. And we can go from there.
Perfect. Well, thanks again for your time. I'm glad you came on, and looking forward to hearing some feedback as agents get in touch and get more information on it as well.
Thank you so much for having me. It was a good time.
Absolutely. Thanks again for tuning in to Insurance Shop Talk. If you enjoyed our deep dive into the latest trends, please don't forget to like, subscribe, and hit the notification bell so you never miss an episode. Until next time, I'm Eric Stein, and this has been Insurance Shop Talk.